Anxiety, depression, ADD, AAD, ADHD, all of these mental disorders and mental disorders like it, 9 times out of 10, they're caused by some sort of trauma. I myself have suffered from many of them. And anybody who has suffered from it, I promise you, they've all wished at some point in their life that they could just wave a magical wand and it be gone and they be done with it. Unfortunately, that wand doesn't exist. And unfortunately, a lot of us, we suffer day in and day out, some worse than others. But what I've learned is mindfulness and meditation, more specifically, isn't just some mystical, some Buddha-like, some this fictional thing. Because I know when I thought about meditation, I thought about it in the sense of sitting down Indian style and wearing a robe, being bald-headed, and having this out-of-body experience, something that was reserved for those types of people. But what I found out is, man, meditation is in some ways that magic wand. It just doesn't work as instantaneous as a magic wand does, you know. Whereas though for me, meditation up front, what it helped me do was gain control of myself. Because a lot of times in traumatic moments and in traumatic experiences, we don't have any control. You know, and once we don't have that control, that's what causes the problems, essentially. You know, and with meditation, it taught me, the first thing it taught me how to control was my breath. Sitting down doing breathing meditations, just working on my breath. It taught me how to control that. And once I could control that, when I come into these high stress situations, when I come into these situations and I'm having a panic attack, or if I'm having a moment of extreme anxiety, or if I want to go and grab, you know, this big burger to make me feel good, or anything like that, if I want to grab a bottle, anything, you know, just something as simple as stopping and it calms everything down. It makes a world of difference, you know. But then on a deeper level, what meditation did for me was it helped me to identify some of those traumatic experiences that were the cause, or that were a part of the foundation of my mental disorders. You know, it helped me identify different moments in my life, different decisions that I had made, different things that I experienced that may have contributed to those mental disorders, you know. And so now I encourage everybody, you know, to just take 2, 3, 5 minutes, if nothing else, to just breathe. Like sit down, don't entertain anything or anyone but your breath. Just breathe, because that oftentimes can mean the difference between a panic attack and a normal day. You know, I tell people, if you find yourself hyperventilating and you don't have asthma and you can't breathe and you need to grab a bottle of pills, or you need to get on the phone and call somebody, you need a therapist, or you need somebody to talk you through it, you know, what happens when that person isn't there for you? What happens when that person can't answer the phone? What happens when that bottle of pills is empty? What happens when that bottle of liquor is empty? Then what? Then we have what we deal with now, suicide on a massive scale. You know, we have violence, people lashing out because they don't know how to do something as simple as control their breathing when they need to the most, you know? So I encourage everybody to just take a minute every day, especially if you suffer from any mental disorder, you know, to just stop and just breathe.